because children are at such low risk from COVID, we're in a situation where there's very little benefit to them from the vaccine, and we've now got people in public health positions who are openly saying that the rationale for vaccinating children is a societal one. They're trying to reduce harm to others, not to the children, which is problematic, especially when we know that these vaccines have very limited impact, if any, on infections and transmission. So when you've got a vaccine where the benefit is not to the person you're giving it to, you need to be absolutely certain you're not causing harm. And we know that there are the problems of myocarditis, and we know that there are several other problems as well. Myocarditis is just one of the problems that we've been alerted to. I think, well, let's just take a step back and see if we can see anything in the mortality data, because obviously, this is an emotional subject, and people could easily be getting there could be exaggeration about how bad the risks are. And in the mortality data as a whole, most people who've taken the vaccine have not died. It's not dramatic. But when we look at the younger age groups, we do see something. And what we see is that there has been an increase in deaths cumulatively from the spring of 2021. And every week we're seeing more deaths than we should be in the male 15 to 19 category. And what's particularly interesting about this category is that we're not seeing it in the females. The female deaths are higher than they were last year, but they're still within the range. You expect a certain amount of variation year to year. The male 15 to 19-year-old deaths are beyond that range. You can't just say this is a bad year, it's beyond that. And we've been calling this out for really many months now and requesting that there be an investigation. So when we've got an alarm signal like this, in a situation where the children themselves are not going to be benefiting, there should be a pause and an investigation, and that's what we're asking for.